And joining me now is the U.S. Surgeon General, Dr. Vivek Murthy. Dr. Murthy, welcome back to Meet the Press.
Thank you, Chuck. Good to see you.
I want to start with, basically, before he even took the oath of office, President Biden was very skeptical, said there wouldn't be a mandate, said he didn't think the federal government would get involved in mandates, there shouldn't be mandates, etc. Now he's changed his mind. Why?
Well, Chuck, from the beginning, the president and all of us have said we've got to use every lever we have in order to fight this pandemic. And that's what you see happening right now. Over the last several months, we've been working hard to get vaccines out to the public, partnering with the private sector, using every power the government has. And now in the face of Delta, we've got to move to the next phase of that response. And that involves focusing not just on expanding the vaccination effort through a combination of mandates and access, but it also involves focusing on increasing our testing capacity, shoring up our healthcare systems, which are really struggling in the face of this Delta variant. So there was a lot in the plan that the president announced because we've got to bring everything to bear at this moment to fight the pandemic.
Is this an acknowledgement, though, that this is, I mean, when you do the mandate that he's describing for private businesses, that feels like the last tool in the toolbox. If this doesn't work, then what?
Well, Chuck, you know, what I would say is let's just step back for a moment. If you look at how far we've come, we've gotten over 200 million people with one shot of a vaccine. That's 75% of all eligible Americans who've gotten a shot and have some degree of protection. But we're not done yet, because what we see is that because millions of more people are not infected, they're susceptible at moments like this with the Delta variant. The requirements that the president spoke about will help 80 million people in the private sector, 17 million health workers, and over 3.5 million federal workers and contractors to move closer to vaccination. And here's the interesting thing, Chuck, that I think a lot of people don't recognize. Many businesses have actually been looking forward to this. The Business Roundtable has said that this is the right move. The American Medical Association, certainly on the health side, has said this is the right move. I think it will help workplaces do what they want to do, which is to make workplaces safer so that people can feel more secure coming back to work and we can keep our economy strong.
Given what you had to do this week with this sort of reset or next phase of battling COVID, it really now puts the decision in May to change the masking guidance on the vaccination. It really looks like that was a major mistake. Why? That seems like the one moment where politics got in the way of science, because the Delta variant was going through India very rapidly. The WHO at that time was saying it was a variant of concern, and we seemed to be acting at that time as if the variant wasn't going to come here. How did we miss this so badly in May?
Well, Chuck, if you talk to the CDC about this, what they'll tell you is that they were doing what they've always done, which is to make sure that they are looking closely at the science and the data and using that to guide their decision making. What they saw in May with the pre-Delta version of COVID-19 was that when people who were vaccinated, when they got breakthrough infections, that they had a very, very low likelihood of transmitting that, which is one of the reasons they felt comfortable pulling back on mask mandates. But then things changed. The Delta variant came, and the Delta variant seemed to indicate that vaccinated people who had breakthrough infections would be more likely to spread than those with the Alpha variant or prior variants. And that's why they shifted their guidance once again. One of the things that we have to be able to do, Chuck, in a public health pandemic like this is we've got to be able to look at the data in real time to adjust our approach accordingly and then communicate that clearly to the public. We've got to be prepared to keep doing that in the future.
When you were part of the campaign during 2020, you were part of a team that emphasized we need a full response here. It's not just a vaccination approach. We've got to get testing and contact tracing going. It does feel as if the approach in the last 8 months has been it's vaccines or bust. Now there's a new effort to enhance testing, but where was this the first 8 or 9 months? Because it does feel as if everything was focused on the vaccine. And I get it. It's the simplest way out, but it's not the only one. And we've got a mass divide in this country that's only gotten worse.
Well, Chuck, you're absolutely right that there has to be a multi-pronged strategy to address this pandemic. And we've actually been talking about that from the beginning. Vaccines are certainly the backbone of that effort, but we know that other mitigation measures like masking and distancing are important. We know that testing is a critical part of the response infrastructure, and we know that shoring up and strengthening our healthcare system so we can take care of those who are sick is essential too. In addition to those being the areas of focus of the president's announcement this week, I've actually been focusing on those over the last many months. The billions of dollars in the ARP that were put toward testing to help schools, for example, have testing in place so they could be ready for the fall were a reflection of that broader set of priorities. The focus on masking has also been a piece of that. The recent announcement, actually, that the president made that we are going to be sending tests, millions of tests, to food banks and to community health centers so that people can access them free, also part of that effort. So yes, it is true that in the news you see a significant focus on vaccines, but let that not convince or convey to anyone that the approach here has not been broad. It has been. I've been part of a lot of the discussions where we're focusing and taking that broad approach, a part of a lot of the community conversations where we're talking to people about the variety of steps we've got to take to get through this pandemic.
A practical herd immunity, and however that wants to be defined, let me define it this way. An uptick of 10 percentage points over the next 3 months, plus the Delta variant sadly ripping through the unvaccinated. Are we going to be at herd immunity by the end of this calendar year because with the combination of what I just described, more Delta sadly ripping through the unvaccinated and a slight uptick in vaccinations?
Well, Chuck, how quickly we get to a level where cases are low and stay low really depends on what we do collectively, not just the government, but each of us as private citizens and what universities and schools and businesses do. If we work quickly to get people vaccinated, then we will get there faster. But we've got to come together. Chuck, let me tell you this, that one of the things that we cannot afford to do during this pandemic is allow the COVID-19 experience to turn us against each other. Our enemy is the virus. It is not each other. And I was reflecting yesterday, Chuck, on the 20th anniversary of 9/11, but what we learned from that terrible tragedy. And one of the things that sticks with me is that in that moment of crisis, we responded by coming together. I saw neighbors helping one another get through this crisis. I saw people turn to strangers who were suffering and offer them support.
I understand that spirit, but some people take the mandate as not a moment of unity, but as sort of a divisive weapon. What do you say to that?
Well, I'd say, Chuck, that the requirements for vaccination are part of a long tradition that we have in this country of taking steps as a collective to keep people safe. We have had vaccine requirements in schools for years and years. You and I, when we went to school, had to make sure that we had certain vaccines before we enrolled. That's to keep everyone else safe. We have requirements when you drive, for example, that you obey a certain speed limit, because we know even though everyone can push as hard as they want on the accelerator, that will actually hurt other people if it causes more accidents. So we have a tradition in our country, Chuck, of taking steps, as a collective to protect the broader community. And that's what these requirements represent. We know that when people wear masks all together, it gives us our greatest chance of reducing infection. When people get vaccinated, that gives us our greatest chance of keeping workplaces and schools safe. And that's what we've got to do, Chuck, during this pandemic. We've got to be all in together, and that's how we'll get through.
Dr. Vivek Murthy, the Surgeon General, thanks for coming on and explaining the administration's perspective. I appreciate it.
Thanks so much, Chuck. Take care and be well.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.